Hello, everyone, and welcome to this webinar today. I'm Francis Seeley from Enfield Climate Action Forum and GlobalNet 21, and this is one of the many webinars we do. And today we're going to talk to Helen Price. Now, Helen is from the Enfield Voluntary Action, or EVA as it's called, and they're an umbrella organisation of many voluntary groups and organisations in Enfield, and they do a tremendous amount of good work in helping and supporting them. And Helen is particularly involved in developing health champions, and we're going to talk to her about that today and some of the work she does. So Helen, thank you for joining us today. And maybe we can start. Could you tell us something briefly about yourself and your work in EVA?
Okay, so I've worked for Enfield Voluntary Action since 2009, and my role has been around capacity building for local voluntary and community sector organisations, of which there are around 1,000 in Enfield. And the capacity building has been in the space of involving volunteers and making sure that that's fit for purpose. But more latterly, I've been running a programme that's supporting voluntary sector organisations to have personnel on their team that are trained to a baseline level in factors around that impact on health inequalities. And so my role has been in rolling that programme out. They're called health champions, members of staff within voluntary sector organisations that have this training. And so it's the health champions programme.
Okay, so what is a health champion?
So a health champion in the context in Enfield is someone who is trained in the Royal Society for Public Health baseline level of competency around influencing health behaviours, understanding what drives people's behaviours that impact their health, and something called Making Every Contact Count, which is an initiative that the NHS are committed to and the local authority, so that every person on the teams, every staff member is able to use every encounter with another person. So whether it's a resident, a patient, whatever label you want to give them, but you are able to say something that helps to influence that person's behaviour.
I mean, the National Health Service talks about wellbeing conversations, and that's what health champions are involved in. I mean, how do people go about creating those wellbeing conversations?
Right, so the health champions on the Enfield Health Champion programme aren't necessarily always in direct communication with residents and service users. The principle is that the health champions have got the knowledge and competencies to be able to instigate opportunities for those health conversations to take place. So the sort of thing that so a health champion is someone who is employed or a long-term volunteer of the voluntary sector organisations. They don't work for me. And those health champions, the desire is that the vision is that they use their existing activities, service delivery and opportunities across networks to disseminate messages around health. The main factor being that they are talking to or being listened to by persons who trust them. So every single one of us, whether we're in work, a service user, a peer, a colleague, a family member of a colleague, every one of us is a human being, a resident and a patient somewhere of a GP practice. So we don't have a distinction about sectors of the community in that respect. It is that the health champions then are able to initiate opportunities for information to be shared. And so that information might be shared, let's say, for instance, if there's a cultural group, an example would be the Enfield Asian Welfares Association that already runs like a lunch club on a Friday or something. It may be that organisation, because they've got a health champion, can build into that social service that they're providing some chair exercise, or they could build in some information and a discussion about smoking cessation or healthy eating or early signs of cancer, symptoms of cancer. And so the conversation as such doesn't follow a particular model, although when it does, it follows a health coaching model of a conversation.
Okay, I mean, I was going to ask you to give me some examples, and you've done that, and that helps to make it a lot clearer. I mean, how many champions do you have, and where do you find them?
Okay, so the program's been running since 2019, and since that time we've trained around over 60 people who work or volunteer with voluntary sector organisations in Enfield. The important thing is to remember is that being a health champion isn't their primary role. Their primary role is their job, their task within their responsibilities within the organisation they work for, and the health champion's role is layered on top of that. So, and I would say that at any given time, around 30 to 40 people are active as health champions. Well, we find, sorry.
No, I was going to say that's quite a huge number in a way. I mean, you mentioned they come from organisations. You don't actually advertise in the general public, do you? They actually come from organisations, and that's the sort of critical thing about health champions, isn't it?
Yes. So health champions are employed by or volunteer by, so they are personnel within a voluntary or community or a non-profit organisation in the borough. They are not members of the public per se, and the reason for that is that the health champion is layering their role as a health champion on top of their existing role within the organisation that they work for, and in that role they are have access to, or the opportunity to communicate with, lots and lots of people who in turn we hope share some of the messaging. So if you're a service user of an organisation, maybe you go to one of their dance classes or something, or maybe you're you're interested in art and culture, and so you go to an art group, but because you're a member of that group, somebody within the organisation that runs that service will use that opportunity of the group of people who get together to share information about something that's relevant, that impacts health. And it might be a socioeconomic factor. It's not always a direct health factor, because we know that socioeconomic factors massively affect health inequalities, which the eastern part of Enfield and other parts of London are severely affected by. So anybody who is a member of the public who wants to become this type of a health champion, we would refer to as like a health ambassador, just to distinguish them from somebody who's employed by an organisation.
Okay, I'll talk to you about health ambassadors in a minute, but just to make it clear again, supposing I was a health champion and I was invited to go to a dance class, which I hope they don't ask me to dance, but I'm invited to go to a dance class. What would I do there?
So you're likely to most people are likely to go to something like that, a service that's being run in the community that's by a non-statutory organisation, because a friend has asked you to go, or because you've seen a little poster in a shop and you just decided that you want to meet people or get fitter. And generally, there is an element of trust. The service is being run by an organisation that it might be a tiny community group that you have heard of and that you trust, or that appeals to you because it seems to have the same values as you. So when you get to that organisation as a service user, you will be, that organisation will share with you what it is they're going to offer you. So if it's a dance group, they'll tell you that they'll do a light touch health assessment with you to make sure that you haven't got any serious health issues that exclude you from being able to take part in that activity. But then you're there of your own free will, and sometimes there might be a small payment, or it might be free that's being offered, and you develop a relationship with other people who are attending. So you become part of a community activity, and the person who is running the session, who might be trained dance instructor, or it might be somebody who's not, but they bring in a trained dance instructor to run the session. The person who facilitates the session and organising it might be the health champion, and the health champion will use that environment to be able to talk to people and have health conversations. So offering people information perhaps about smoking cessation or early symptoms of cancer or something. And because you're in an environment as a service user where it's social and you're relaxed and you're with people you trust, you are going to probably have a conversation that you wouldn't have with your GP. And as a result of that conversation, it might not be terribly in depth, but you might share something like, "Oh, I'm too stressed to give up smoking, and I don't want to do that, and I get lonely, and so it's something I do to I enjoy it." So the person, the health champion, is somebody who is trained to be able to take that conversation in a direction that helps you as the participant in the service, which is the dance class, but helped you to think about other aspects of your health. And because you've spoken to somebody in an environment you feel relaxed in with people you trust, evidence suggests that you are more likely to start a journey of behaviour change. And because behaviour change is what's required to help people access better health and well-being, that's the crux of the matter with health champions, is that they are in a position to have those trusted conversations.
And how does that link in, if it does at all, with social prescribing? In a way, I can see a sort of link there.
Yeah, so social prescribing is a term that has been coined by the NHS to describe an activity whereby a professional, a member of staff within the clinical environment, the primary care network or the mental health environment, or within a hospital environment, a person within that clinical environment is trained to talk to people about socioeconomic factors which affect their health. So somebody might be overweight and suffering with respiratory problems, and perhaps is diabetic. And so going to their GP, that person will be treated for being diabetic, for being overweight, and other factors, clinical factors. But the social prescriber is trained to talk to someone about what matters to them, and to tease out what the socioeconomic factors are that are affecting their health. So in the case that I've just given, it might be that the person finds it difficult to walk, and it might be that they find it, and this is a real case, they might find it difficult to walk because their shoes don't fit properly, and their shoes don't fit properly because they've not had very good foot care. The social prescriber can link the person in to a foot care program, a service, where in some instances the service will come to their home and, you know, do things like, you know, give them some foot care, shorten toenails, help them with the care of their feet, and even help them link into, you know, being able to access some decent shoes for the purposes that they need, which is walking. And then that person now has had a non-clinical factor dealt with, which means that they actually are no longer in pain or discomfort walking and moving around, which means that they could go to dance class, even if it's just to watch. And although that seems very, very a slight change, it's a huge change for somebody who has developed health conditions because they can't move around.
So social prescribers and health champions are into the field of non-clinical intervention.
Yes, they're in the area of non-clinical interventions around factors, so socioeconomic factors which impact people's health. The health champions focus is on disseminating and sharing information to people who trust them about factors that could influence their health and well-being, because they would find out about early symptoms of cancer, for instance, or support for stopping smoking, or support and access into healthy eating programs or walking programs. So there's a different emphasis with health champions to social prescribing link workers. And social prescribing link workers are actually a paid post within the primary care, the GP system, where they will work with a patient, with an individual one-to-one over a period of 12 weeks with sort of around 6 appointments, and will help that person access services in the community. Whereas the health champion is much more about education and information, and also a little bit of information about pathways.
Okay. You mentioned training. I mean, health champions obviously are going to be having conversations, and they're going to have some degree of knowledge, both about how to make conversations and about health. I mean, what is the training? I gather there's accreditation as well, isn't there?
Yeah, so a health champion, so EVA recruits health champions from organisations that are not-for-profit and voluntary sector in the borough of Enfield, and those organisations have got a knowledge of the communities, either demographically or geographically, where they work. So health champions will have all sorts of levels of training depending upon what their core job is. So an organisation has to apply to put one of their members of staff onto the health champion programme, and once they've been accepted, and we run these training twice a year, they complete a 3.5-day training programme with the Royal Society for Public Health, RSPH, and that consists of a section on understanding health and health behaviours, a section on influencing health and health behaviour. So that will be about the types of conversations you have to get people to think differently. And then there's a section on making every contact count, which is the model used by statutory services to make every intervention or every connection with the patient have meaning. And then that course is an accredited course, so there's an assessment, and it's a level 2 qualification. The health champions then continue with the training, and they're trained in mental health first aid, which is a 2-day training programme run by a mental health foundation, training a qualified person.
Okay, you explained, what a health champion is, and they come from organisations and they get training. Now, you know that I'm interested, and a lot of us are, in climate change, and And climate change has an impact on health, so there's a very real issue there. You wouldn't use health champions for that, would you? You would have someone who could maybe come from the general public, who are there to create awareness. In a way, they're ambassadors. So health ambassadors, if that term is the right term, is very different, isn't it, to a health champion?
Well, the difference is on focus, I think. I mean, the health champion is a more defined, prescribed role, which is within the scope of a person's paid job, or if they're a long-term volunteer. A health ambassador would be a member of the public who cares about the issue, in this case climate change, and perhaps would support and work with health champions to be or maybe they would be completely independent. They themselves would be able to access knowledge and information through something like your program, so that because every single one of us has influence over other people. We have family members, we have friends, we have people we know, our neighbours, we have people we know through the activities, the hobbies that we have, or the activities that we have, and we know people through our jobs if we're in employment. So a health ambassador would be somebody who could influence those people in the sphere of their own life about the messages, the importance of taking responsibility for climate change. And of course, a health ambassador could then go on to do other roles. They would effectively be a volunteer for the programme of climate change awareness. And if they wanted to get involved in a more formal capacity through helping to organise events and campaigns, then that opportunity would present itself. But the key factor is that the person is not using a formal work environment role to be a health champion. They're using their personal life as a member of the public.
And do you know if there's any training? Obviously not as extensive as there is for champions, but do you know if there's any training for health ambassadors?
Yes, there is training for health ambassadors. And it's not a watered down, it's a simpler version of the accredited training that health champions would complete. Because at the end of the day, it's all about us having improved health literacy. So all training is around improving our health literacy, and that's a journey for all of us throughout our lives. You very often don't know much about something until somebody has a diagnosis of it, and then you suddenly you make yourself an expert. So health literacy, it would be the underpinning training, and the element of having meaningful conversations, the making every contact count principle. I experienced this by way of an example when somebody who had been trained as a health ambassador a few years ago, I was just talking about my own, I don't know, I must have been talking about going on holiday and would I fit into my clothes? And this person asked me a few questions. And it was only afterwards I realised I'd been health ambassadored, because this person just quite naturally and casually had asked me a few questions which were meaningful and made me think. And I run a programme, and I hadn't realised at the time that she was asking me questions which came out of training. And so it's that subtle, it's that subtle encounter which is really powerful. But you sometimes need to be trained in a few techniques in order to take advantage of it.
I mean, take one example. I mean, we're quite interested in probably developing climate cafes. Now, cafes is a safe place where people can come and talk about their anxieties. Now, is that something a health ambassador could get involved in, or could a health champion get involved in? And we know that the Climate Psychology Alliance provides training for those people. So could they get involved in that? And would the Psychology Alliance training be sufficient for you to accept them as health ambassadors in your view, or possibly help with a health champions portfolio as well?
Yeah, absolutely. Absolutely. Like a lot of things in the voluntary sector, um, opportunities evolve from need, from people's passion, from the current environment we find ourselves in, what is going on and what is influencing the way people care about the world they live in. So yes, the answer to that would be yes, and I'd be really interested in following that up. And there is a good model for climate cafes, with the mental health cafe model, where you get people together and you start to talk about an issue in that social environment, but there's always an action. There's an action involved in it, because that's what we need around health.
Yeah, I mean that's quite interesting, because the model by the Climate Psychology Alliance is that cafes just talk about anxieties. They don't have any action involved in it.
Oh, right, okay.
The Scottish climate cafe model does have action. It's a slightly different one, but we're looking at having climate cafes where people who talk about anxiety one month, and the following month a community hub where they can talk about action and link with other organizations and doing things. And I think ambassadors and champions could really get involved in that, but we're only beginning to sort of develop that now, which is quite interesting if we can do. So, I mean, you'd be interested in that aspect, would you? And would you see climate change then becoming a part of your sort of agenda as well in what you do?
Yes. Can I just clarify that when I said action, I meant it's not just an open-ended conversation. It's one where people can seek a next step if they want to. So it's not about campaigning action. It's about the fact that this isn't a dead-end conversation where we talk about it and then all walk away shaking our heads thinking, oh, isn't it all terrible? But there is some structure to it. Yes, climate change is very much on the agenda for health champions. A small cohort of them have been trained in I say been trained. They've attended education sessions run by a specialist in how climate change impacts on health, and some interesting actions came out of those sessions to do with waste and recycling within the NHS environment. So we had some interesting impacts already from that, which only took place in September of this year, 2022. Yeah, I mean, climate change is just so linked in direct and indirect ways to our health.
I mean, it was interesting how you defined action, because that's quite important, because very often if people are anxious, they want to know where they could go to, what they could do. And in a way, a health ambassador or a health champion, even more so, might be able to make those contacts for them. They might be able to tell them where to go, what they could do, where they could get more help. So they could be a really valuable input to a cafe, couldn't they?
Yeah, absolutely. And that's that we live in a society which is more and more connected than ever before through technological advancement, but is also people exist in silos as well, or in isolation. And for people to be able to, and very often we have action because we're asked to. So if I share with you an anxiety I have around climate change or whatever, if you are trained or aware enough to be able to say to me, did you know that there's a group in your area that actually campaign about this, and they meet at a cafe on a Tuesday or whatever it is, then I've got an option there. You're not recruiting me or anything. You're letting me know that there is an outlet for action. Now, I might not want to get involved in campaigning, but I might be interested in dropping into the cafe to see what it's all about. So I think these subtle actions are really, really important, because they're sustainable and they tie in with what matters to people. So that they feel that they've got agency around issues that concern them. And sometimes, the information people can receive or share as health ambassadors and health champions with other members of the public or their environments, their work environments, or the service users, is information that in itself is to specialists is run of the mill, but to members of the public or to Joe Blogs out there, it's not. It's not run of the mill. It's actually quite life changing in terms of perhaps knowledge around recycling or how you can lobby your local councillor for change around emissions and speed limits and all sorts of stuff. I mean, knowledge and connection is power.
Yeah, I mean, I think the networking of knowledge is really important. That's valuable in the work you do, and it's really important. I mean, we've come to the end pretty well of our 30 minutes now. I mean, if people wanted to know more about what you do or how they become a health champion, or just find out about the work of EVA, where would they go?
So you can go to our website, which is www.enfield, V for Victor, A for Andrew.org.uk. So that's www.enfieldva.org.uk. And information is on there about all of the services that we offer, including the opportunities for members of the public to volunteer. And if the health ambassador's role becomes developed and it is available for members of the public to get involved with, the volunteer centre part of our website would be a place to look for that. And all of our staff members' email addresses are on the websites.
Okay, well, thanks for telling us about that, because I think it's really interesting, and I'm really sort of encouraged that you look at climate change as being an important part of the work you do going forward. And I'd really be happy to work with you on developing the cafe idea and some of the things you said about networking knowledge, because that's vital. So I think everything you've told us has been so valuable today, and I'd like to thank you for taking part in it, because I think it will be helpful for a lot of people. So thank you, Helen, for doing the interview today, and we'll end the interview now.